Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
Hi, this is Dawn Melanie with a special episode of my series called Managing Self, where I discuss with you how I manage myself dealing with multiple sclerosis for the past 20 years. Today, I thank you for joining me because as I am recording this show, and you haven't heard my words yet, me speaking them has already given me strength for what is occurring in my life, that I'm dealing with my multiple sclerosis. Basically what's happening in the very near future. Tomorrow morning, actually about 3.5 hours, I'll be receiving a new medication for my relapsing, remitting multiple sclerosis. This is my 21st year as a resilient MS warrior, and since diagnosis, which was, March 11th, 1999, the only time that I have not been the recipient of a DMT or disease-modifying drug was in the past 4 months. Now, this time was designated by me and my neurologist as a time allotted for my previous medication to basically flush out of my system, thus allowing for let's say a clean slate for which new medication to work. How do you feel not having taken any MS drug the past 4 months? My response is simple. I feel great. No hesitation at all. I tell them that I feel great because actually I do. I haven't had any complications or increased fatigue, more than usual, or anything like that. I feel good. But like one friend also asked me, I also had some recent thoughts. I talked to my husband about it just earlier tonight. Why? Why was I going to put my body through more unknown? Flooding it with these potent drugs, medications, some would say poisons, not knowing if it would even help me. It may actually worsen my situation. But the point is, I did question why. It's okay. It's okay to ask why. Why is one of those, I want to say, inflated questions at times. Because it's so simple. Just three simple letters. But some people can look at it as simple. Some people may interpret it as inflated. But this is a question that I've asked why. And it's okay to ask why. Let's see, Bernard Baruch. He said it. I like the way he said it. That millions saw the apple fall, but Newton was the one who asked why. You see, there's great things that came from asking why. And before I start this medication, I want to ask questions continually, through the process, before I take it, while I'm taking it. It's going to take, 5-6 hours for the infusion to run its course. But I'll continue to ask why, and even after, and keep my physicians informed. Me asking why is me being a advocate, being my own best self-advocate for my health, which, of course, I always recommend that we all do. We need to be responsible for managing ourselves. So you get an idea of how serious this new medication is. I told my husband it's sort of like having an oil change. Instead of every 3,000 or 5,000 miles, which is commonly recommended before an oil change, there's that synthetic oil, which they claim you can go 10,000 miles before an oil change is needed. Okay, so the medicine I was taking was every 28 days. An infusion once every 28 days. Now I'm going to be getting my oil topped off, per se. But the medication will be administered every, or shall I say once every 6 months or twice a year. So 2 times a year versus 13 times a year. So this is how serious I'd say how strong the medicine is that's going to be put into my body. Ask myself why. So whatever I do because I think it's necessary. I ask why. Why do I make this change to change my medicines? Well, because I think it's necessary. And that's the truth, my truth. See, my truth is my belief, a fact or belief that I accept. I accept this is the best course for me of managing my multiple sclerosis, and I'm acting upon that. In over 230 months, I've changed my DMTs 6 times, or 5 or 6 times. Tomorrow will be like the 6th or 7th time, and I've only changed when I rationalized that it was the thing to do. Either medication wasn't best for me, maybe determination after MRIs came back with a significant amount of additional lesions, especially those that indicated MS activity. Any empirical evidence of such that was there, pretty much black and white, on the reports that were based on the films, which were the pictures of my brain. Well, I made a decision upon that, on the hard facts. I say my truth. My truth is, look what we have here. This is what Dawn needs to do. So my truth is how I responded. We all respond differently. We use the word truth loosely sometimes, and it really is personal to each and every one of us as individuals. I think it's kind of funny because my truth is, well, I have MS over 20 years, and I'm often found in front of a camera lens that is taking pictures. Some would say, well, so different people will use different adjectives. Some would say sexy, some would say inspiring, whatever. But it's funny because of all my photo shoots, some of my most valuable photo shoots, my absolute most valuable photo shoots are those of my brain. The 200 or something images that are taken on each MRI. These shoots, the images, the results, the findings from those shoots actually strengthen my complete trust or my confidence in something that I can't really see. My faith is there. So, I can't see, I can see, sometimes I can see the holes in my brain, okay, the lesions, the indications that once are flashing, I can see that, but, it's my faith that goes beyond that, and this empirical evidence, it is what it is, but my truth is, well, there's a higher being that is taking care of it. Yeah, I have an MS diagnosis. Yes, I know I have MS. Yes, I know I have lesions in my brain. Yes, I know I can't see, I can't walk, I can't talk at times, but I know that I'm okay. That's my faith. With every MRI that has been done, at least like 50, every infusion I've taken, 109 to date, every blood draw for testing purposes, everything that I go through, I try not to worry. I try. I try, and I pray this pretty much every day. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. The Dalai Lama once said, if a problem can be solved, there is no sense worrying about it. If it can't be solved, worrying will do no good. In my 46 years of life, I've learned that, Well, I realize now that what the Dalai Lama said is pretty much true, at least as it pertains to my life. I know that I've had worries. Try not to have worries, but I'm human and I have worried. But I know now that it doesn't do anything but hold our. No, it holds. It's like it holds me hostage. Let's say that. Worrying about something. Attention that I have that I can dedicate. Energy that I can dedicate elsewhere into to being more productive. That worrying just holds me hostage. Somewhat like a prisoner to my own self. It's pretty silly and futile if you ask me, because I realize now it's like, why am I worried about things that I can't even control? It's like, okay, that exists, this exists, that exists. So much in life exists that we can't control, and it's this elevated level of uncertainty that we hold on to that and grasp onto it and fail to release it. But that holding on to that uncertainty, it doesn't do any darn good. It just fuels out our anxiety. We feel less productive. Like, okay, this might happen, that might happen. Yeah, whatever, it might happen. Whatever. The feeling of anxiety is not productive. It's making you a prisoner, your own prisoner, if you understand me. You're a prisoner of your own self. So I've learned, I try, again, I'm not perfect, but I try to not focus on those things and redirect my focus on something that I can control, in hopes of producing a successful outcome. For the Pareto principle, the 80-20 rule, 80% of how we feel or whatever is basically 20% of what we do. Likewise, 20% of the things that occur to us aren't really causing the stress in our lives. It's 80% of the stress that we experience is our reaction to them, how we react to those things. So with that being said, I want to present to you all a challenge for the upcoming week, and the challenge is to, sit back, stand up. I don't care if you stand up and do it. I don't care if you're walking on the treadmill like I often do, but think about some things that you don't feel like you have control of. Whatever the topic is, I don't know. Maybe it's let's just say your MS medication. What you're taking. Maybe you don't like your current cocktail of things that you're taking. Whatever it is, maybe I don't know. You want to get to the gym more. You want to get there 3 times a week instead of twice. Whatever it is in your life, identify what it is and what is not in your control. And if whatever's occurring that you want to change, are you focusing on the outcome rather than the process? Because there's a critical difference there. Goals focus on outcomes, but those are really pretty much out of our control. So I want to recommend that whatever it is that you think you or have control of or don't have control of, break that down to smaller goals, or into smaller action steps. Yeah, action steps. That way we can achieve those or make progress with that. Because again, the process is what we need to focus on. It's ongoing. There's nothing more that we can. There's nothing more that we can ask of ourselves to do than to continue to work on the process of gaining control. That is what we can control. Am I saying just don't worry about anything, just kind of float through life mindlessly? Hell no, I'm not saying that at all. Using the words of Leonard Cohen. He said, there's a crack in everything. That's how light gets in. I think we all agree that the light is the good. It reveals the good. The evil hides in the darkness, and we don't want to stand in the darkness. So it's interesting because cracks are usually negatively looked upon. Cracks in our I know cracks in my face. I'm 46 now, and yes, I do. I'm aware of fine lines and wrinkles of that sort. Not many, but it's more than I was when I was 25 for sure. So, things like that, that imperfection. Ooh, it makes me unique. Just like my gray hairs, I like them, I embrace them. But, we look at cracks in our face, cracks in the pavement in our driveway. We don't want the cracks. We don't want creases in our clothes that have been starched and from the cleaners. We don't like that. But we have to be careful not to allow any imperfections of our ideal or ideas. Get careful not to let those imperfections or idea of perfection sabotage our ability to become what we have potential to be. We're all different. Everybody with MS, no two individuals are the same. Snowflake disease. We're all different, but we all are the same because we're all great. We're marvelous. We're imperfect creatures who are great, despite our oftentimes our misguided ideals we have of ourselves, of our bodies, our minds, our achievements, what we've done or haven't done, ideas about our relationships. Sometimes, whatever the area is, if we fail to be perfect, per our definition, that is a big part of how we feel about ourselves, our self-worth. And I want to warn you all, be careful, because if you allow this to go on and not be aware of it, it could lead to a degree or let's say a phenomenon even worse, and that is self-loathing. Where now we're feeling that we're not good enough, and I know I'm good enough, and we're all good enough, but we have to believe that in our minds first for it to come to fruition. And I just want to make everybody aware to think. We said words are powerful. There's power of power of life and death in the tongue, but I think even more important is the power of the brain. The brain, our control center of everything that we do, what we say. We need to be careful of what we expose our brains to, what we allow it to do, to see, to just experience, and especially as far as how we present ourselves to ourselves. Attain a goal or any of these perfections that you're trying to achieve, please do not think that it's a failure on your part. That's incorrect. I do like the term Wabi-Sabi. It's a word or a term used in Japan and Japanese aesthetics. It's centered on actually imperfection and the aesthetic of imperfection. Wabi-Sabi actually celebrates transience, individuality, and the flawed. Not perfection, but the flawed. Per Wabi-Sabi, the beauty is in the imperfection. I do love that idea. I even have a mug with Wabi-Sabi on it. Ask my husband. I personally like it so much because I always say it reflects how I usually, I'll tell people, well, I ain't perfect, and there's many aspects of me, many angles, many facets, and I embrace them all. Wabi-Sabi, since it celebrates imperfections, it's sort of a realization of me embracing that and putting the emphasis where it should be. That is a continual process of improvement. That's where my mind should be. I shouldn't be so caught up on trying to be perfect, but always striving to improve my current state. Yeah, I do have type A personality, no doubt, but understanding what Wabi-Sabi and that concept, it helps me to embrace my imperfections and understand that by having that mindset, it champions Wabi-Sabi champions a forgiving past. So I may not have done something perfectly, but it opens up the opportunities for me to progress, always moving forward. No matter how small the steps are, moving forward is important. It's important to get that out of your head that I must be perfect. I must be perfect. I have to do 100% all the time. Absolutely, absolutely. That's not necessary. And I say this to you, but I often have to reel myself in and say it to myself. And I recommend that you try or be aware, self-aware, and maybe have the discussion with yourselves as well. It's funny, we talk about communication all the time. I know, we say good communication, like me and my doctor tomorrow. I'm sure I'm going to have a lot of questions and answers tomorrow about the medicine. That good communication that we're going to have is going to help bridge any gaps between, misconceptions or expectations, things like that we may have that differ. Same thing goes with relationships. It goes with everything. Good communication bridges gaps, and a good communication with ourselves helps us to be objective. Remember, I said we don't want to have develop any self-loathing towards ourselves. Well, I believe that a good communication with yourself, just kind of sitting back and reflecting on things, some people may call it meditation. That communication with yourselves will help you embrace your flaws, things that you may not have gotten perfect, but embrace your flaws with curiosity, not with a judgment. So kind of, maybe you made a mistake, you didn't do something like you wanted to, but think about it, kind of reflect upon why you did it and how it can lead to an opportunity for you to expand your horizon, to be a better version of yourself. Don't be judgmental, self-judgmental. Again, just look at it as an opportunity to expand that limitless abilities we have to improve ourselves. I'm aware that every experience that I go through helps me to grow. Even the ones with some irreversible setbacks. My MS flare-ups, a definite example. Lost my vision. Actually, 11 years ago this month, I lost my hearing about 4 times. All these things have been restored pretty much 100%. But there's some irreversible setbacks, like my hands. I can't feel anything. That is, I can feel, but I can't. My senses are out of whack, shall I say. Everything feels like sandpaper, and water feels like it causes pain whenever I touch water. But anyway, that's a weird setback. But again, it helps me to grow so that I can appreciate the things that I can feel or see or smell or use my other senses for. I have a greater appreciation for those things. Life isn't perfect, but I count my blessings for the things that I do have. I appreciate my abilities, and I try to focus on my disabilities. All of our abilities are unique to us. I know mine are very unique to me. I look at any of the things that, I speak of perfection. You know what? even if I can't do something perfect, I need to keep in mind that whatever it is just a tool. Not like a hammer or a wrench, but it's a tool to help me recognize what I can use and how I can benefit from what I have. That's what counts in my opinion. Self-improvement, for me, anything I can do to find an opportunity to improve myself is a good thing. Again, in my opinion. As I conclude this week's show, I want to present to you all a challenge. This one's basically to ask yourself some questions, that are small questions, trying to figure out ways in which you can improve yourself, your life. Then format the answer or answers as a goal. Once you derived or devise that goal, log it into whatever medium you use, a journal, what have you. And the reason why I say to log it is because as you work towards that goal, each task that you complete is going to be experience gained. So whether or not you actually complete the task or not, it's experience gained. So you'll ultimately be tracking your progress and recognizing your accomplishments and your shortcomings, of course. But hopefully, the most important point that I want to stress is that you'll be seizing the opportunity to take action, to bring you a step up from where you are or where you were. Big steps, small steps, stumbling ones, falling down, I don't care. What matters is that you're taking continued steps upward towards your goal. This has been Dawn Melanie with Managing Self. Thank you for joining me, and I do hope that you'll join me next week for another episode. Until then, I hope you have a blessed week. A week of spontaneous imperfection, resulting in improvement and learning. Thank you.